to get a better understanding of the hantavirus, we've got Dr. Emily Abdallah with us live this morning. Thanks so much for joining us, Doctor.
Thank you for having me.
Yeah, excited to discuss this. Many people have questions following the news of the outbreak on that cruise ship. Should people be concerned about what's happening here?
The risk to the general public, as many others have said, is very, very low. This is an incredibly rare infection, and this is one particular type or aspect of a very rare infection. And from everything we know about the Andes virus species of hantavirus, past cases, as well as what we're seeing play out so far on the cruise ship, you aren't seeing a lot of transmission or any transmission beyond the cruise ship itself. It's really from what we know of this infection in this aspect with the Andes virus species, it takes prolonged close contact in most cases for the infection to spread. And I think you can see that playing out in the fact that there were 140 some people on the cruise ship, and to date we only know about 11 cases, and all of the rest of the individuals are being very closely monitored. And so if you are sitting in Michigan, I think you can rest assured that your risk from this particular outbreak is very, very low. It is important to think about the risk to the hantavirus that we have in the United States, but that only comes from exposure to rodent droppings.
All right, really glad you clarified that. I want to talk more about that because this, of course, has many people afraid, thinking back to COVID and pandemic times. But we've heard from health professionals like you that this is different. It doesn't spread in the same way as COVID. You talked about that prolonged close contact. What exactly does that look like? Of course, with COVID, we had social distancing, we had our masks. What does it look like in order for that transmission to happen with hantavirus?
Right. So what we know about this, the hantavirus, the Andes virus species that's found in Chile and Argentina, and which is what has been implicated on this cruise ship outbreak. It's a rare infection. Again, only so many cases that we know about, but they've done extensive testing in those cases where there has been human to human spread. And what a lot of the reports tell us is that people who share bedrooms, even intimate partners, they're at higher risk than even household contacts. It can still happen within household contacts, but it's really that intimate or close, prolonged contact. Now, there was an outbreak in 2018, 2019 that affected about 30 some individuals in Argentina. And in that case, they were able to show that a person who was symptomatic went to a crowded indoor party, and that the people sitting nearest to that person over the 90 minutes or so that the symptomatic person was there, a couple of them did go on to develop hantavirus. But again, that's not the number of infected and the ease of spread that we see with things like COVID or influenza or even other respiratory viruses, certainly things like measles. And so generally what we know is that the closer the contact, the more prolonged the contact, the higher the risk, but it's not large numbers like we've gone through recently as a population with the COVID pandemic.
Well, say you are exposed and you do find yourself contracting hantavirus. You've said that this is extremely rare, but say that does happen. What are the symptoms you should be looking out for? How long does it take for those symptoms to start to show?
Right. So regardless of where you contract hantavirus in the Americas, so we're talking about the hantavirus species that we have in the United States, as well as the ones that we see in South America. If you are exposed, and this is usually through, remember, the exposure to the rodent droppings, often the first symptoms are not very specific. It's can look like any kind of viral illness. So people can have fevers, they may feel a little off or tired. We call that malaise. They may have headaches or joint pains, or they may have stomach upset, nausea, or vomiting. So that can look like a lot of different things. And there are many, many things that are much more common to cause those symptoms than hantavirus. It's after that first phase, which we call the viral prodrome, that people can then develop the severe respiratory symptoms that are indicative of the hantavirus pulmonary syndrome, which is the severe manifestations of hantavirus in the Americas, in the United States, and in South America.
Well, we've just got a little bit of time left, Doctor. Really appreciate your time. I want us to end things with what should we be looking out for next? Of course, we know the Americans that were on that cruise ship have returned. Some of them are being monitored by choice because I understand it's not mandatory that they stay for that monitoring. What should we be looking out for next in terms of our concern or possible spread here in the U.S.?
Right. Well, what I think that this situation shows is just how critically important public health responses are. All of the individuals who have come back to the United States, as well as in other countries as well, from what I understand, they're having a lot of interviews with public health officials to figure out how close they were to any confirmed cases of hantavirus on the ship, who else they may have been around during any period of the ship's journey, how things went. And so they're trying to do that's called contact tracing. So they're figuring out, is there anyone else who needs monitoring? The issue with hantavirus is that the incubation period is long, meaning the time from when a person can be exposed to the time they develop symptoms up to 6 weeks. And so from what I understand, public health officials are calling the first day of that 6-week period, the day they were able to get off of the ship and then be isolated from other passengers who might have started to be able to spread hantavirus. And so I think that the suggestion of isolation and the close monitoring and the interviews and really trying to understand that we have a full concept of who may be affected is essential, and that requires a lot of work and public health expertise. And so this that is really critical to the response, not just here, but in any country where one of the exposed passengers is returning to.
Dr. Emily Abdallah with the University of Michigan Medical School, really appreciate your time this morning. Thank you.
Thanks for having me.